Hello, good day everyone. Welcome to today's session titled How Community Responses to COVID-19 Support Healthy Aging. Before we get started, I'd like to go over just a couple items so you know how to participate in today's event. When you join today's webinar, you selected to join either via phone call or computer audio. If for any reason you need to change your selection, you can do so by accessing the audio pane in your control panel. You'll have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel there. You can send your questions over at any time and we'll collect these and address them during the Q&A session at the end of today's presentation. I now would like to turn things over to John Feather, CEO of Grantmakers in Aging and moderator of today's webinar. All yours, John.
Thank you so much, Alex, and welcome and thank all of you for joining us today. I want to thank Tufts Health Plan Foundation for their support of this webinar, and as always to the John A. Hartford Foundation for their continuing support of the entire Conversations with GIA webinar series. Our communities continue to grapple with COVID-related challenges, broader, systemic, seemingly unending issues with long-term implications that change how we think about everything. We have an opportunity to consider the future with insights from lived experience. What have we learned through this pandemic? What would we change in our responses? What can we carry forward into life and work beyond COVID-19? Tufts Health Plan Foundation partnered with the Massachusetts Executive Office of Elder Affairs, Massachusetts Healthy Aging Collaborative, and FSG, a mission-driven consulting firm, to research and report on 6 Massachusetts communities, their responses, experiences, and insights from the COVID-19 pandemic. During today's webinar, you'll hear key findings and recommendations to create more inclusive and equitable systems of support for older people so that next time we are better prepared. As mentioned earlier, you can enter your questions for our panelists at any time in the question box on the right side of your screen. I will collect these and read the questions during the question and answer period. Now, I would first like to introduce Nora Moreno-Cargi, President of Tufts Health Plan Foundation and Vice President, Corporate Citizenship at Tufts Health Plan. Nora?
Thank you so much, John. Before we get into the panel, I just want to pause and recognize John for his leadership and work at GIA. I have been honored to work with John this now past 6 years as a member of his board of directors. John welcomed me into this field and has been such an asset to our work, has been a champion in aging and a resource to our foundation, both to our work in community, our presence nationally, but also me personally. John, thank you so much for all that you have done. You will be missed in this role, but not in the field. I know you're sticking around, and so we look forward to continuing to learn from you and to as we all enter into this next chapter of GIA. Well,
thank you so much, Nora.
Good afternoon. This year I turned 60. I'm going to shout it out loud. It is exciting. It's the same age that our governor, Charlie Baker, here in Massachusetts, realized that life does not end at 60. And while he joked and quipped about the significance of his birthday, he also intuited that given the demographics of our state and our world, that it was critical to begin to address issues of aging in a deliberate and mindful way, because it affects everything that we do, our economy, our social vibrancy. And so what did he do? He convened the Governor's Council to address aging in the Commonwealth. He brought together cross-sector representation, because we know that it isn't just one sector that is affected by aging. And so this council has broad representation, which is also indicative of its approach to its work. It builds on a movement age-friendly communities have been around in Massachusetts for a little over 10 years. And since we started to work collaboratively across sectors and comprehensively with key stakeholders, it has seen a substantial and significant growth. We learned from our partners at AARP around how to get it's better together when you think about age-friendly communities and dementia-friendly communities. We saw that it was important to support new ideas, new ways of doing things, opportunities that emerged from community. And so when we were struck with this pandemic, we knew very quickly that it was adversely affecting older people, and that in addressing what was happening in community, we needed to be mindful that the people who most understood how to address their older adults, their population, in their neighborhoods, in their communities, were those people who were working boots on the ground. And so we wanted to find out what was going on, what was working, what was not working, what were the needs that were emerging, what were the things that we needed to consider as a funder. And so as a funder, we were in this unique position to get out of the way, to listen and to learn and to share what we learned, and to leverage the collective power of community and to understand what was happening in community, both in terms of collaboration, in terms of what was working, and in terms of what was not working. And so in that spirit of collaboration, I want to introduce to you our partners and our panelists. You have their bios, so I just want to say at the highest level that the way we're seeing great results in Massachusetts and in those states where we work is to really deliberately think about those people who understand and who can really have impact. So Robin Lipson, we've been working with her from day one. She is the Deputy Secretary of the Executive Office of Elder Affairs in Massachusetts and has been a strategic thinker with us and partner. And personally, again, Robin has been a friend and an incredible resource to our foundation and what we do. Leslie Melendez is the Deputy Director of Groundworks Lawrence, this community-based organization who is through its name very, very reflective of how they approach the work. They are boots on the ground and they think about it again from a cross-sectoral perspective. And last but certainly not least, someone who I've come to know and really appreciate, Tiffany Clark, who is a director at FSG. She has been incredible in terms of this work and in terms of creating for us a tool that can help inform our work as we look beyond the pandemic. And so with that, Tiffany, I turn it over to you.
Thanks, Nora. So to get us started today, we wanted to provide an overview of the work that will support the panel discussion that will follow. Next slide. So as Nora mentioned, we wanted to learn from people who are doing the work on the ground and to not waste the opportunity of the crisis, as difficult it has been, as an opportunity for learning what people have been doing to create a more inclusive and equitable system of support for older adults, to look across services, policies, funding, how people have been working collaboratively, how people have been engaging communities in this challenging time, to derive the lessons that we should carry forward into the future. And so we embarked on a project to conduct research with 6 communities that were particularly affected by COVID-19. And through the spring and summer, we conducted 35 interviews with people representing numerous types of organizations, including community-based organizations, elder services, social sector and social service organizations, healthcare, government, etc. to really understand from the perspective of these 6 communities that have been particularly affected by COVID-19, what they have been seeing and doing and learning, what support they would really like to see, and what they think are the next steps in the future. The way that we selected these communities was very intentional. We wanted to include some communities that were seeing a high number of cases, that were really responding to increased infections, that had high proportions of frontline workers, people who were dealing with the threat of exposure, as well as systemic issues in their communities that were contributing to disproportionate impacts. We also wanted to include rural communities, people who were more geographically isolated, more spread out, tend to have older populations and were contending with the pandemic in their own ways. And so these 6 communities comprised the focus of the report, and then we also looked at state level policy changes. Next slide. The report, as Nora mentioned, is intended to be both a support for learning and also a tool for people to use to plan action going forward. And so it includes both findings about communities' responses to COVID-19. We explore the conditions that older adults were most impacted by COVID-19 experienced. What were those structural factors, the barriers, the ways that ableism, et cetera, are reflected in the way that our society is set up that led people to be most disproportionately impacted by COVID-19, as well as the protective factors that people experience in their lives that can be leveraged to support them more effectively going forward. We also explored the adaptations that communities made, the ways that they adapted services and supports to make information more accessible, to make services more available, more convenient, at higher volume, more culturally competent, and how policy adapted as well to support people and communities. And we also explored remaining gaps that people highlighted as being important to focus on going forward. And we lift up lessons learned, ways that people worked together differently, collaborated more effectively, set aside their established norms and perceived risks in order to gain the kind of flexibility and ability to work together that really bore them through this crisis. And we also lift up recommendations for how to support continued response to the crisis, as well as recovering and rebuilding, particularly in terms of sustaining the flexibility and creativity that supported communities' responses, in terms of balancing continued crisis response that people know is needed, and also equally important, resuming long-term work to address systemic gaps. What will it take to balance both of those types of work? And finally, recognizing the not surprising, but certainly upsetting fact of the disparate impacts of COVID-19 on minority communities, Black and Brown communities in particular, as well as others, providing recommendations for explicitly supporting efforts led by and for communities of color, and shifting the culture and practices of organizations and groups to support equity and justice. Next slide. So this resource includes discussion questions, planning tools, and recommendations, resources, and ideas for getting started. And we hope that these will support a few key next steps. The first is continuing to build the age-friendly movement. As Nora said, this work has been 10 years and beyond in the making, and there's a lot of momentum to build on. How can we use the learnings from this experience to make that work even deeper and even more grounded in the reality of the moment? And inspire new ways of thinking and action by engaging a number of communities and stakeholders in dialogue about what we're taking from this report and this experience to inform the future. And finally, continuing the conversation, continuing to gather examples and share learning across communities, across the state, and across the region and nationally. So there are a number of aspirations for this resource. We've already gotten positive feedback from the communities that participated, that they're looking forward to using this to inform their strategic conversations. It includes recommendations specifically for funders and policymakers, people who are reading the context in which communities are working, so that they can reflect on the opportunities to create the conditions that support strong, adaptive, community level work. So I'll just pause there and I'll turn it over to John for the panel discussion.
Well, thank you so much, Tiffany, for this summary of the work and the great job that you've been doing on this effort. I do want to also personally thank Nora for her kind words, but also the tremendous leadership she's provided both in Massachusetts and nationally on creating age-friendly communities. She's a person who really believes in that effective work has to be done at the community level, and that's how it gets done. Then you move it up to the state and national level. So thank you, Nora, for those kind words. I am going to engage with the panel for a few minutes in terms of a discussion, and then we'll turn it over to your questions as the audience. So please continue to write in your questions as you see on your screen there, and we'll be getting to those shortly. But first, let me ask a question to Leslie. How did COVID change your work, and what were some of the barriers that you experienced?
Thank you, John. Good afternoon, everyone. My name is Leslie Melendez, and I'm the Deputy Director at Groundwork Lawrence. And we have been working closely with the Lawrence Council on Aging on this age-friendly project. And one of the things that happened very quickly early on was that we were no longer able to engage with seniors and with others in terms of being able to provide services. We were very quickly able to pivot and adapt to that, but a lot of what happened was really focused and shine the light on technology and the lack of technology, or the lack of being able to use technology. We were also really taken aback by how many of our seniors weren't able to access food. Food became a very big barrier in our community, not just for our elders, but for the community as a whole. And that was, one of the things that sparked conversations among all of the MPOs and the municipality to really look at what it was that we were doing to help with that situation. I would say that another one of the barriers was, back to the technology piece, was folks didn't have technology, especially our elders. It was really difficult for us to be in contact with them. It was difficult for them to do telehealth. It was difficult for them to, see their grandchildren, or to just have a conversation with friends. The fact that the center had to close and people didn't have those social interactions really shone a light on how difficult it has been and continues to be, again, not just for our elders, but for the majority of the folks in our community.
Well, thank you, Leslie. And I want to return to you for more insights about the work going on at the local level. But I also want to bring in Robin here to talk about the work that's going on at the state level. So, Robin, it'll probably be useful for you to talk a little bit about how the state organizes its effort, and particularly around the age-friendly communities efforts that's been going on for a while. But then I wanted to ask you the specific question is, where are the opportunities that you see at the state level?
Thanks, John, and thanks, Leslie, for shining a light on the issues that are so important for all communities right now. So to give you some context, Massachusetts has a plan for its age-friendly work, and that's a plan that is shared by a very broad, collaborative, and large group of stakeholders. And I think that one of the most interesting things about the ecosystem in Massachusetts on these issues is that we have been working together in partnership with the Tufts Health Plan Foundation, with the Councils on Aging, with the Aging Services Network, our friends at AARP, and many, many, many others to align our efforts. So we all know what our goals are. And our goals are really to have every community in Massachusetts be considered age-friendly or dementia-friendly or both in whatever way that makes sense to them. So my role as the state lead on this is not to tell communities what to do or how to do it. I want them to do what matters most to them in a way that works best for them. My role is really to help drive policy at the state level so that the whole is greater than the sum of the individual community parts, and so that we are helping to direct resources where they're needed, to remove obstacles, to replicate best practices, and to generally make it easier for some of this great work to scale. So that's kind of the context that I come to you from. In terms of what the opportunities are at the state level, I think that the research that FSG did has pointed out some really, really important things for us to consider. So the first thing that strikes me from what Tiffany has shared is that in these communities, relationships really matter. And we heard story after story about how a long-standing relationship and trust in a community helped them be nimble and responsive to the pandemic. So one of the stories someone referred to relationships that they had developed during the HIV crisis, which was back in the 80s, probably before some of the people listening to this webinar were old enough to listen to webinars. And it's just very, very striking that the relationships and the trust and the history is a very important ingredient in an emergency and in the ability for communities to take a few risks and move quickly and responsibly. And I think the second thing that we learned was that the urgency of the pandemic, I think, almost gave people permission to go ahead and act without seeking all kinds of approvals and process. And I think that we need to consider that as we move forward. I mean, I love the speed and nimbleness and responsiveness that communities worked with without having, to have 6 million meetings, go through 92 committees, or look to regulators and others to approve their ideas. And I think we need to consider that as we move forward. And then the third thing that I take away from this is the real need to solve for technology access. I think for those of you who work in the health field, we really need to think about affordable access to technology as the new social determinant of health. We need to consider how we get that access to people. I've talked to many, many, many older adults who tell me they have technology. They know how to use it. They have a data plan, but they're not using that data plan, or they're not going beyond that data plan because they're saving access to talk to their children, not to do telehealth. They don't want to incur expenses to take a class. They're really, really concerned about the affordability of their internet access. And I think given how reliant people are on technology to get through their day-to-day lives right now and to be socially engaged and connected, we have to look at technology access as a social determinant.
Thank you, Robin. Those are all very important things. And I think the discussion around access to technology, use of technology, and so forth has become a really important discussion in lots of areas, not just aging, but certainly it's brought the focus on what we can do to bear in a very different way. So Tiffany, let's turn to you. I think it would be great if you could introduce the audience a little bit to FSG and its work. Many people will be familiar with it, but some will not. But then the question, did this research identify gaps? And if so, what are they? And how do we think we're going to move forward in approaching them?
Sure, thanks, John. FSG is a mission-driven organization, primarily consulting, but also initiatives, all geared toward equitable systems change. And we've been around for about 20 years now as an organization, and do a number of different types of work, but I think the piece that's most relevant here is work on collective impact and multi-sector collaboration. So we co-convene the Collective Impact Forum, which is a practitioner-based community all over the country and world, the thousands of people that are working on multi-sector collaborative efforts to strengthen them and increase their impact. And then we also work with foundations and corporations and collaborative groups on specific strategy, evaluation, and research projects in their communities and nationally and globally. And so the lens that we bring to this work is certainly around systems change and around collaboration. And so I'd echo in terms of gaps that the research surfaced. There were some kind of topic specific ones, as Robin mentioned, and so did Leslie, technology being a big one, communication and the ability to reach people in multiple languages to ensure that everyone in the community is being reached, and food access were big ones. Then there were gaps that, when we're thinking about the future, span specific issues. And I'll just highlight a few. One is financial sustainability. So as Robin mentioned, people really, when faced with a crisis and a moment where people needed to act, they set aside their pre-existing strategies often, and they set aside some of their financial considerations during a time when services were becoming more costly to provide due to the need for personal protective equipment or social distancing, fewer people working, and also where a higher volume of service was needed and continues to be needed. And so when we think about continuing to respond to the community going forward, there needs to be a deeper consideration of how to support this work and get it on a path where higher cost, higher volume services are financially sustainable for organizations. When we know the nonprofit sector is very threatened right now financially and needs support. Then there's the piece around flexibility. That was really key across specific issues and topics, how to continue adapting. And so people have come together collaboratively, they've leveraged their pre-existing relationships, and they brought a lot of momentum to their response. But we're in this middle zone now where people have gotten into a certain rhythm related to crisis response, but need to bring attention back to longer term considerations for creating communities that promote health and well-being. And so people need to have the mindset and the support and, quote unquote, permission to balance their attention between those two needs, and also in doing this work, use what they've learned through the pandemic to deepen the equity focus of some of these longer term strategies. In many communities, there's already a concerted attention on equity, but the pandemic has created a lot more opportunity to take stock of work and make sure that it is as inclusive as possible, and to deepen the nature of the relationships and the work so that it is as inclusive and equitable as possible. So I guess I'll just pull up from all of that and say people have been coming up with the solutions, and what they need is the ability to continue adapting as this moment pushes us to keep coming up with new solutions for emerging problems and needs.
Thank you for that, Tiffany. Robin, let's stay with that issue for a moment. I mean, you obviously are a key person in the state in terms of aging issues. Do you see, in the face of a crisis initially, there's always more adaptability usually, and it seems to have been the case this time. Do you see the state and its mechanisms as being more flexible going forward, like in the next 5 years? And also, what do you see as the next steps now that you've seen the research that's been done?
Thanks, John. That's a great question. Absolutely, we have to be more flexible going forward. I will tell you that over the past 6 months, I watched my entire team think through every nuance of every service, from providing a home care service to investigating a complaint or an allegation of elder abuse. And I watched them think through and then execute in really no time at all changes to all those services. So something as simple as someone getting a homemaking service, right? Someone who maybe needs some help with their house cleaning or meal prep. We actually changed those services and changed the way we paid for them so that we could provide people more meals and more support in the instance that maybe a worker couldn't get in there frequently or that a family member wasn't able to help. We looked at things like cleaning and chore services and added new services so that if someone had COVID or there was someone COVID positive in the house, we changed that service to be a deep clean and CDC compliant intervention to help sanitize and sterilize the home. So those are really small examples of things as a state agency that we did very, very quickly. And I think as the situation evolves, we're going to have to continue to adapt and make those changes. And to be honest, my team is pretty feisty, and I think they enjoyed, not that anybody was enjoying this work, but I think they really were very, very up for the challenge of what the situation presented. And again, the urgency gave us some permission to just go ahead and move, right? We were trying to save lives. We were trying to keep people out of nursing facilities and out of hospitals. And that kind of urgency really let us act in a slightly different way. And so I think moving forward, what we really need to do, as Tiffany said, is we need to think about some of these learnings and make them part of our steady state and operating going forward. I don't want to have to reach out to any organization in Massachusetts and say, stop doing that thing that you were doing in the pandemic that was really, really useful. So I don't want to reach out to people and say, roll back telehealth or stop providing classes over Zoom. In fact, people in my religious community were joking about, please don't roll back Zoom services. You know, maybe we don't want to go to church or temple anymore. Maybe we just want to do it from our living room. So I think there's this notion that we don't want to take any of the flexibility and technology away or any of the new adaptations away. I think the other thing we have to do going forward is we really have to focus on mitigating isolation and increasing connection for people. And I think that plays into some of the issues we've already talked about with technology, but it also means we have to think about how we connect with and serve the people that we don't know. You know, I think some of these interviews revealed that people know who they are serving, and they may have aspirations for serving more people, but it is very, very hard to develop a connection strategy with groups of people who you don't know. And I think that's going to be very important as we go forward. And I think the final thing I'll say in terms of us, what we might be doing going forward is I think we have to understand the value of older adults empowering some of the solutions. They've been really, really important contributors, whether they are volunteers or whether they are paid professionals. But using older adults and recognizing them as part of the solutions going forward, I think has to be vital to our recovery.
Thanks, Robin. Let's turn back to you in your experience at the local level. You know, we've talked about flexibility. We've talked about a variety of specific things that people are doing. What have you found to be easy to implement locally, and what's been the hardest thing that you've had to do? And how do you think this is going to roll out going forward over the next year and maybe the next 3 or 4 years?
Thanks, John. So one of the things that you know, we as an organization and as a partnership found easy, if you can call it that, was to respond and to pivot. As many of you know, a couple of years ago, the Merrimack Valley had a horrible tragedy. We experienced the gas explosions, and very quickly, because of so many partnerships that were already established in the city, realized that we needed to pull together as nonprofits to support the municipality, to support the state on all of the things that were happening. We put together working groups, we met regularly, and then that kind of subsided. But what it did for the community of Lawrence was really set us up for being able to respond quickly when the pandemic hit. When folks were told that they needed to stay home and they could not go out unless it was for, basic necessities, we were in a position to be able to work together to respond to those that needed us the most at that moment. And food was a big piece of that. So we were able to pull together a food working group that then, working with the center and with Martha Velez and her team, who are an exceptional group of people, were able to start gathering donations and getting food out to people, delivering food to the elder housing places, and delivering food to homebound seniors, delivering emergency supplies to people who had been diagnosed with COVID and couldn't get out and didn't really have any family or friends that could support them through that. So although that crisis in 2018 was very, very difficult, it really did give us the opportunity to be able to respond, right? And to be able to really step in and be for the community what the community needed at the time. I think the hardest thing has been that we want to be able to help everyone. We want to be able to reach out to everyone, and that communication piece has been difficult. Trying to get folks on the phone, trying to, because you can't knock on doors, but trying to let people know what the resources are that are out there, and not just through the traditional social media flyer dropping ways, right? Because there are a lot of folks that aren't on social media. There are a lot of folks that don't do email. And how are we adapting to that and making sure that folks are, that they know about the resources? So I think that one of the things, as we think about all of this work during the gas crisis and during the pandemic, we were in the throes of planning our age-friendly work, right? We were doing surveys, we were collecting information, we were doing focus groups, and all of that had to take a backseat to what was happening in the moment, and we had to respond real time. And even with that, people were still willing to get on the phone and have conversations and answer questions about the survey, so that we could really continue the work on a parallel track to the response to the pandemic. And I think moving forward, as Tiffany, Nora, and Robin have all said, it's that flexibility and adaptability that organizations and municipalities and the state government have shown that will continue to get us through this next year or two, but really give us something to strive for in the future, and the ability to continue the work in a way that makes sense for everyone and not just a prescribed way, right? Like in that meeting people where they are and supporting the work where people are instead of having people come to you.
Thanks so much. All of those things are very important lessons, and things that we're hearing from people around the country, I think, as well. Nora, I'm going to pull you into the conversation here for a moment. Obviously, you wear two hats, both in terms of your position in the corporation itself, but also as head of the foundation. And many of our listeners today are also funders. And so talk to us about what you've learned about this process. Are there things that you think foundations and other funders can do more effectively that you have learned from COVID and this whole process?
Thanks, John, for that question. I think about this a lot as a funder, as a Latina, as someone who's in a new community. And I want to say this, as funders, we are now getting kudos for how flexible we are and how nimble we've been and how responsive and relevant and present we have been through this crisis. And so I feel like that is something, and I'm now alluding to Robin's remarks about that we need to move forward. And so like in my mind, I've started to concoct this response when someone says, oh, we can't do that. I want to say, oh, I saw you do that during COVID. You were nimble, you were able to be responsive. And so I think that as I think about the work that we do as a foundation and as a team, you know, we were able to approach our board to say, we need more money. And so we dipped into our corpus, into our endowment, and got more money out the door faster than we have ever done. Now we do that because we have a great team in Kimberly Blakemore and Philip Gonzalez, but I feel like to be able to turn around money quickly is about how you are connected to community and to know what's happening. And so as I think about those things I want to have us as funders moving forward, it's like, stay nimble. Don't go back and honor your bureaucracies. Let that go. Understand that there is great wisdom in community and that we should be unapologetic about a deliberate focus on equity, on diversity, on inclusion, because if we believe what we're hearing now in our communities, that there has been systemic racism and that racism has adversely affected those communities most in need, then we need to change. We need to be nimble and we need to be responsive and relevant. And so that's what I hope as a sector we hang on to. And I loved what Robin was saying about this steady state as we have changed, as we have adjusted, that we should, in a very practical and deliberate way, focus on those things that matter most, even if they're small things, even if it's just about identifying one person to go into the house as opposed to 3 people to deliver services. If it's about adjusting those systems so that they are responsive and reflective of what communities need, then that's what we as funders should be doing. We should be pushing up against those systems so that they are not what they have been in the past.
Thank you so much, Nora. Many words of wisdom there. And obviously, part of it is that you have to be connected to communities all the time, because I think as all of you pointed out already, the old maxim from community development that work proceeds at the speed of trust is certainly relevant to all this work. So we're going to turn now to the questions that you have submitted, and I want to start with one. So what have you learned about the role and participation of organizations that are not focused on older adults in the community level COVID response, and were they included in this research? So Leslie, let's start with you on that one, and everybody can respond. What have you learned about reaching out to, the health folks and the transportation folks and the other folks in the midst of this crisis, and not just the aging services community?
We've learned a lot. And again, I'll refer to the fact that we had this crisis a couple of years ago, and it really taught us, Lawrence we tout ourselves as a community of partnership, and that nothing is done in silos. And that's not completely true, right? Like there's silos that happen, that's just the way of the world, but we definitely work cross collaboratively to make sure that we're doing what the community wants us to be doing. But during COVID, we did have to work with the health department and the boards of health, and we had to work with the various municipal departments, but had to work a lot with state and with our funders and our, to put in a shameless plug here for the foundation, the Tufts Health Plan Foundation. We said, this is what's happening here in Lawrence with COVID, and we can't finish doing what we said we were going to do. And they said, okay. And the fact that our funders, not just Tufts, but others as well, have really been nimble and have been amazing to support the work that needed to happen for us to respond to this. But it's so important to continue partnerships, to think about non-traditional partnerships. We've partnered with, youth sports leagues to talk about the different things that are affecting our youth and with this pandemic. We've partnered with businesses and restaurants to be able to help support some of the small businesses that are in danger of closing. So it really is that focus and that ability to partner with your partners that you have and partners that you never thought about.
That's great.
I would add to that. Oh, sorry, go ahead.
Go ahead.
No, I was going to say that this is Robin. This is Robin. What I was going to add is I think some of our most enthusiastic partners have been unusual suspects. This has been true in our age-friendly work, but especially true in these past 6 months. So I'll give you 2 examples. The business community in Massachusetts has become increasingly concerned for their employees who are also caregivers for older adults and other family members. And so as a business community, they have come together to work closely with us and our collaborators to try and support these working caregivers and to, de-stress the very difficult situation that many of them find themselves in right now, as day programs and other support services are less available than they used to be. And then the other unusual partner for us, and this is just in the past few weeks, has been the Registry of Motor Vehicles. So even though our governor and many governors are saying it's safer for older adults to be at home, nobody wants their license to expire. And in Massachusetts, we have a requirement if you're 75 years or older that you have to renew your license in person at a registry. And so we were able to work with the Registry of Motor Vehicles so that there's 1 day per week that is set aside for older drivers who are coming in. We help the registry understand how to be age-friendly, that in fact, if you have people standing outside waiting in line for an hour or more, you might want to get them chairs. You might want to give them clipboards to fill out forms, and you might want to let them have easy access to the bathrooms without losing their places in line. So, that sounds, not that this was complicated, but we had not really thought about going where older people are, like to the registries, and having some folks from our Elder Services Network be there as people are waiting in line, so that if they have questions about services or they need to know how to access fresh food or whatever the issue is, that those resources are right there in a very easy, comfortable way for people to connect.
Those are all wonderful examples. Before we turn to final comments from our speakers, I think we're probably going to have time for just one more question, truthfully. But the question is particularly around rural communities and rural aging. What processes and strategies have you utilized to identify local leaders to move age-friendly efforts, particularly in the rural sectors? And I know you have a couple of communities in your research that talk about this. So I don't know, Tiffany, you want to start with that one, and we'll turn to everybody else as well.
Yeah, I can get it started. So I'll just talk about the example of the Hill Towns region, which had a pre-existing consortium of councils on aging that's been working together across communities and then also within communities to bring in a number of partners, as Robin mentioned, people who focus in the aging services world and also people from local or regional planning and transit related organizations, health, the libraries, etc. And so in those communities, I think in some ways similar to the more urban communities, people came together across types of organizations, across ways that they typically focus their work to sit down and say, how do we support older adults during this time? And in the case of some of those communities, it was actually possible to make a list of every older adult in the community and go one by one and call people, to show up at people's doors, to make sure that people had transportation solutions in areas where there wasn't public transportation, where communities weren't walkable, where people needed solutions to come to their door and ways to get around within the and so we saw some similar adaptations that reflected the kind of unique problem solving that people with knowledge of the rural context brought to the work.
Great. Others want to talk about that issue? Let's see, I think we do have one more. What have you learned is needed through or model of telehealth applications? Can it be COVID related, like post-COVID or other home care services? I think the issue here is I think to take a step back, because this has been a big discussion in lots of things we've been doing recently, there was a rapid expansion of Medicare payments for telehealth work and interventions and so forth. And amazingly enough, given that the stereotype is that older people don't use technology, this was very, very widely embraced and very enthusiastically embraced. And now people are worried that if COVID eventually goes away, we'll go back to the old system and not have the ability to use this as well. So I guess the question is, how have you learned from COVID about the telehealth issues, and what are you planning to do into the future around this? So Robin, I'll toss that one to you, and then we'll see if anybody else has anything to add to that.
Thank you. So let me put a disclaimer out there saying that I am not an expert in Medicare payment, nor do I have much control over what Medicare does. But I'll tell you a couple of things we've observed and some ways that we're thinking about this. So, telehealth is very broad, and it, could cover everything from needing to see a dermatologist to seeing a mental health professional to having some kind of physical exam or intervention. And I think what we've learned during all of this is that there are many instances in which people are quite happy to engage electronically. And that in fact, for some people, the person who has serious mobility challenges and needs to arrange transportation a week in advance to get to a checkup, that being able to do some of that remotely is a wonderful, wonderful innovation. So I don't think that those of us who work in aging want to see any of that disappear. And so, we certainly are talking about this with our own state programs and our Medicaid programs. And I know there are conversations going on with CMS about this, but I can't predict how they will turn out. But I think it's important to look more broadly than telehealth and think about some of the other ways that this can help us. So for instance, in high transmission areas where day programs, supportive day programs, and adult day health programs have not been able to reopen at capacity, can we think of ways to bring some of that programming to people electronically? Or can we think of ways for people to engage in exercise and social activities electronically? And we need to keep working on that, because even, on the day that COVID is no longer a threat to us, we still have snowstorms. We still have people with broken legs or who can't, get out easily because of a knee replacement, or maybe who can't get out. We're seeing a pickup in programs from folks who are at home because they're caregivers and they wouldn't leave their loved one alone. But if they can do the program from their house, they're doing it. And we need to take all that into account as we move forward.
Well, thanks so much. I think at this point, unfortunately, we're going to need to move to final comments from each of our speakers. And so if you could give a minute or two of your wisdom to our audience. And Tiffany, we'll start with you.
Thanks, John. I just wanted to emphasize something that's come up a lot in this conversation so far, which is that people in communities have been doing heroic work. In fact, people all over the world have been. And the solutions come from people coming together, working collaboratively, and being committed to doing whatever it takes and adapting continuously. And whatever we all can collectively do to create the conditions for people to do that well, to have the collaborative skills, the resources, the support from the state levels, from other sectors, the kinds of partnerships that enable flexibility, innovation, and collaboration. That's what's going to see us through this next phase of whatever it is we may be encountering. We don't know the future, but we'll need to find ways to get through it together.
Thank you so much, Tiffany. Leslie?
Well said, Tiffany. Thank you, John. I echo everything that Tiffany just said, and continue to encourage folks to listen, to really listen to the folks that are being affected the most. Listen to community. The work happens at the ground level. The work happens with the people that are experiencing the various things day to day. I mean, we're all experiencing it, right? We're writing the playbook as we live it. But to really be able to do this work effectively and to really be able to answer the needs, you just got to listen. You really have to listen.
Thank you, Leslie. Robin?
Leslie, that's such a great point. And I think what I would add to that is that even the smallest things matter. I don't want for people listening to think, oh, I don't have the resources to start a big program or to fund a big initiative or the infrastructure to make major systems change. I think what we've learned is that even the smallest things matter. A drive-by visit, an activity package with some things to keep people busy, a note from a school kid, a way to get more food from food pantries into people's homes. These small things all add up, and they really, really matter in community.
Thank you, Robin. And Nora, last word goes to you.
Thank you, John. Thanks to everyone on this panel. As a funder, I am proud to have the great partners that we do have. And I think that my wisdom is just don't lose the lessons. Don't lose the lessons. We have learned a lot during this time. We've learned that we are resilient and can really have an impact. And I just want to make sure that as we reflect on what we've been through, that we just don't forget.
Thank you so much, Nora. I want to thank Nora Moreno-Cargi, Robin Lipson, Leslie Melendez, and Tiffany Clark for their participation today, but also for their great work throughout this whole process and continuing work that's going to move forward as we continue to try to address this crisis and crises to come in the future. I also want to thank Tufts Health Plan Foundation for their support of this webinar, and to the John A. Hartford Foundation for their support of the Conversations with GIA webinar series. We have 2 webinars coming up for you. The first one on October the 27th is on the COVID-19 checkup, a scalable strategy for reducing COVID infections, hospitalizations, and deaths among older adults and other high-risk populations. And then one on November 10th on Rural Transportation Connects. Both of these are going to be excellent, innovative programs that you'll want to hear more about. Those will all be on our website, or you will receive these notices directly to you. We will be making today's presentations available to anyone who wishes to view it later, including both the slides and the audio. Please watch for an email to be sent within the next few days. And finally, I want to thank all of you for participating in today's webinar. Please stay safe.